All right, some positive news in the nation's vaccination effort after another manufacturer announces its promising results from its clinical trials. Novavax released data today on its Prevent 19 shot. It's said to have an overall efficacy rate of more than 90%. And trials found the two-dose vaccine is 93% effective against the predominant variant circulating right now. Dr. Ron Elfenbein is the medical director and owner of First Call Medical Center. He joins us now to discuss this new data and a lot more. So, Dr. Elfenbein, what is different about this vaccine compared to the other three already in use here in the United States? And it does start to feel, given that there are other countries that are struggling to vaccinate their citizens, that we are blessed and lucky to have a wide range of choices. But do we need a fourth vaccine?
Well, yeah, I think you hit the nail on the head there, Vlad. You know, it's one extra one that we probably, in the United States, probably don't need at this particular time, because we have surplus of vaccine and we have people that don't want the vaccine. So we have way more vaccine than we have people that want it in this country, which is kind of a shame. But it's great that we have this fourth option now. Now, you asked a question of what is different about this vaccine. Well, the Novavax vaccine, unlike Johnson & Johnson, which is sort of the traditional, it uses a cold virus to kind of infect our cells to then get our cells to sort of develop the immunity. The Moderna and the Pfizer vaccines are mRNA vaccines, so they get our cells to sort of start producing proteins that our body reacts to. This particular vaccine, the Novavax, uses what's called the nanotechnology, which is a proprietary technology that they developed that they say allows them to sort of change the vaccine very quickly and develop vaccines very quickly. It's the first of its kind. It's a pretty interesting vaccine, and it's a pretty interesting science. I mean, this whole thing has been fascinating if you think about it from a scientific perspective. Within a year and a half, we now have, well, less than a year and a half, we now have, as you said, 4 vaccines available to treat a virus that was brand new in 2019, which is just completely unheard of and absolutely amazing. This vaccine in particular will be great for the rest of the world because it doesn't require ridiculous refrigeration. It can be stored at regular refrigeration temperatures, and it is a 2-shot vaccine, 21 days apart, with incredibly high efficacy. So this would be great for poor third world countries versus the Pfizer vaccine, which Pfizer has just agreed to donate 2 billion doses to the rest of the world. But unfortunately, it requires to be kept at minus 70 degrees, which most countries can't do, except at very, very few centers. So this vaccine, and the Novavax, really would be a game changer for the rest of the world.
And that may mean that it would be particularly good when it comes to tackling some of these variants. The Delta variant is on its way to becoming the predominant strain of COVID here in America. In an interview with CBS News' Jan Crawford, Pfizer CEO spoke about how effective the Pfizer's vaccine is against this variant. So I want to play some of what he had to say.
Okay.
I feel quite comfortable that we cover it. We will not need a special vaccine for it. The current vaccine should cover it. When a new variant emerges, immediately we are testing how the current vaccine behaves compared to this variant.
So this is good news for people who are vaccinated, particularly with the Pfizer shot, but what about Moderna or Johnson & Johnson?
Yeah, it's a good question. You know, their preliminary data is preliminary, and it seems to support that it is effective as well, but we don't know those numbers yet because it hasn't really been published. You know, the Pfizer vaccine has, the data says it's 88% effective against the Delta variant, which is the B16172, or so-called Indian variant, which is now, as you said, Emery, the dominant strain in most of the world now. You know, so the people with Pfizer should feel comfortable that they're going to be okay. But, you know, you're right. The other vaccines, we don't really know yet at this particular time. We need more information.
So there's some new CBS News polls that show more Americans are venturing out, whether they have gotten their shots or not. In fact, unvaccinated Americans appear more comfortable going to crowded events or eating in restaurants than those who are vaccinated. I find these polls remarkable. And certainly, for example, Dr. Elfenbein and Anne-Marie, I made my return to the gym last week, and if you are fully vaccinated, you don't need to wear your mask. That's what the gym's policies are. You don't need to wear your mask at the gym, but if you are not fully vaccinated, you must wear your mask. But given what these poll numbers show, I don't want to be that dude walking around thinking, is this guy vaccinated and he's up here huffing and puffing on the treadmill, or is he not? And I have no criteria to base my analysis on other than human frailty, right? In other words, I'm like in my brain thinking like the way he's dressed must mean that he's not vaccinated. So, I mean, what does this mean for her? I'm being a little humorous, but it is a little concerning because we've got to deal with this Delta variant. What does it mean? What do these numbers tell you?
Yeah, when I read this poll, I was completely shocked. I thought I was misreading it. I had to read it twice because I was like, is this true? I mean, unvaccinated people are twice as likely as vaccinated people to travel and go on cruises and date and go to the gym, as you said, Vlad. It's kind of mind-boggling. But I think it sort of goes back to, it's a kind of a chicken and egg sort of thing. It's like vaccinated people are more likely to be, more concerned about COVID. So they will then be more likely to think about this kind of stuff, whereas the unvaccinated people aren't that concerned, so they just say, well, it's not that big a deal. But then remember that the vaccinated people think to themselves, all right, I'm aware that people at the gym and people at the restaurants and stuff are likely to be unvaccinated. Those people who are unvaccinated are out and about, which makes me more likely to catch COVID, which makes me less likely to want to go out. So it's kind of like this vicious cycle. If you think about the demographics of these people in general, I mean, obviously this is generalizing and this is polling data, which we know can be a little bit unreliable. But, those people who tend to be more concerned about COVID tend to be more liberal. They tend to be older. They tend to have a higher income bracket and they tend to be of higher education. So, it's just, I think it's kind of this vicious cycle where people will say, well, I don't want to catch it. I'm worried about it to begin with. And I know there's people out there that don't have it, so I don't want to go out because I might, even though I'm been vaccinated, I still might catch it. So it's really crazy, and it just deals with human psyche. It's just.
But Dr. Elfenbein, one of the things that people will say to me, and Anne-Marie knows this well, is that they'll say, well, what are you worried about, right? You trust in the science. They told you, meaning you, the government, Fauci, that if you're vaccinated, then you're not at risk. And I understand that. But it's a cascading situation, right? So let's say I catch COVID at the gym from somebody who's unvaccinated. It doesn't affect me. I don't get sick. I'm asymptomatic, but I get tested every day when I come into CBS News. The test picks up that I'm COVID positive. All of a sudden, that has an effect on my colleagues. That has an effect on this broadcast. That has an effect on CBS This Morning. There are people that I work with that may not be vaccinated I could spread to. So all of a sudden now I got to stay at home and I can't be with Anne-Marie or I can't be with you. And it's like it's a whole thing, right? I mean, it's not just, I think people sometimes think, well, I'm not going to get sick, so what's the big deal? But the reality is I know that even if I'm vaccinated, the chance of me spreading it if I catch it are low, but there's still a chance. And it just means that I got to be out of work. You know what I'm saying? It's like this whole series of events that happens.
Yeah, and you could certainly make the argument that people who choose not to get vaccinated to some extent are being very selfish because, that you're right. They put everybody else at risk, right? They put everybody else at the chances of you catching it go up because you're now exposed. Even though you might not get sick and you might not need to be hospitalized, you can still catch it. And then you're right, because then you're out of work. The broadcast has to be shut down. All the people who work there have to be quarantined, and all these cascading events that affect potentially thousands of people's lives and livelihoods. That because somebody goes to the gym who you happen to work out and you're doing the right thing, but they might not. They might just say, nah, I don't need to wear my mask. I haven't been vaccinated, but no one's going to know the difference. And now they've just exposed 30, 40, 50 people. That's a big deal. And you're affecting thousands of people's lives, potentially even millions of people's lives. So, it's a ripple effect, as you said, and that people need to really think through that before they choose. Look, if you choose to not get vaccinated, that's a choice. But then be smart about it. Don't go out without a mask. Don't go out to a gym. Don't violate people's, businesses' policies. Do the right thing.
I think that's so good. I mean, we're talking about the impact on the newscast, and just so you know, the broadcast would not be shut down, but I would carry the weight for you, Vlad, you slacker. But sort of more seriously though, because I do know people who are, recent cancer survivors. These are people that, they are particularly vulnerable, so maybe they can't get the vaccine right now. And so I ask people out there to think about those people that, you know, the rest of us, maybe you spread it to us, we don't actually get sick, we don't know we have it, but there are other people that it really is sort of a life and death exposure, and they're still wearing their masks, and they're not going to the gyms, and they're being extra cautious. So, you know, consider the effect that you might have on someone who's more vulnerable. Dr. Ron Elfenbein, once again, always a pleasure talking to you. Thank you so much.
Thanks, guys. Have a great day.
You too.